Good afternoon. I'm Darren Maloney, a member of the CMC Board of Trustees and a Senior Vice President in the PNC Commercial Banking Group. It's great to see everyone here today. Today's forum, Age-Friendly Columbus, is brought to us with support from National Church Residences and Regionomics, each represented by many of their friends and associates here today. Please help me thank them. And welcome to the podium, Michelle Norris. She's the Executive Vice President of External Affairs and Strategic Initiatives at National Church Residences. So welcome.
Thank you. Good afternoon, everybody. And thank you, Darren, for the introduction. And we thank you for allowing National Church Residences to be a sponsor of this great event. We have supported the mission of the Columbus Metropolitan Club for over 40 years as it's continued to work in our community, to engage our community in conversation in topics that are so vital to the public interest. Well, one of those topics is one that is near and dear to our hearts at National Church Residences. Today we convene a discussion that is central to the mission of our organization, which is about Central Ohio's population of citizens aging 65 and older. Many of you have heard the conversation and the discussion that we will be doubling that number in the next 35 years. As people age, their abilities change. Our communities must adopt. They have to be able to find easy access to services, to amenities, to opportunities, to transportation, all the things that are going to be important as we care for those who are growing older in our community. To ensure that individuals of all ages and abilities can thrive in their neighborhoods and to live a high quality of life independently. So let's learn more about this age-friendly Columbus from our speakers. First, I want to introduce our speakers to you. We have the President and CEO of Lifecare Alliance, Chuck Gehring. We have the Director of Programming for the Osteopathic Heritage Foundation, Susan Beaudry. We have Columbus resident Daniel Sinclair, and I had the privilege of talking to Mr. Sinclair at lunch. What a delightful man and a great life experience, and thank you for joining us. He serves as the resident council president for JC Arms, and he serves on the Older Adults Advisory Council for Age-Friendly Columbus. He is a veteran and a long-term community activist. We also are joined with Columbus City Councilman Mike Stinziano, and we have Age-Friendly Community Coordinator for MORPC, which is Katie White. Did I miss anybody? Katie will be starting us off with an overview of the initiative, and then Councilman Stinziano will be hosting our conversation. So Katie, would you please come to the podium?
Good afternoon. A room full of very age-friendly faces, right? So we'll start with the history. In 2014, the Kirwan Institute and the Ohio State College of Social Work published a report that outlined the state of aging in Franklin County, as well as opportunities to meet an aging population with success. During this time, Village Connections, Central Ohio Area Agency on Aging, and Franklin County Office on Aging were holding conversations about the age-friendly cities movement. Also at the same time, the Mid-Ohio Regional Planning Commission released their report called Insight 2050, which gave us a glimpse into the projected demographic changes. So this trifecta, or perfect storm, of information and leadership overlapped in such a way that the funding, guidance, and direction for age-friendly Columbus came together swiftly. And how often does that happen? We all know not very. But Age-Friendly Columbus is a true example of the collaborative spirit that our city embodies. So I'm sure you've heard the projected demographic changes. Numbers like 1 in 4 residents will be 65 or older, or 10,000 boomers retire every day. And most often, these are presented with a negative connotation. But what about the positive numbers that we can create in our environment? Those numbers are also staggering. 80% of the country's personal net worth is held in the 50-plus population. And what about the $75 billion annually they save our economy through their volunteering and civic engagement? We have a real opportunity here. In Columbus, Our 2014 census estimates say we have 76,000 adults 65 and older. So if you think about that in terms of 50 and older, there's many, many more. And by 2040, that will double. Every fourth person walking down the street, every person on the C bus, every person waiting in line at the grocery, 1 out of 4 will be 65 or older, as compared to 1 out of 10 right now. So we hear these challenges, and we know that we've got our work cut out for us. So when Age-Friendly Columbus is complete, our city will be a place for people of all ages and abilities to actively age and lead a quality of life, where neighborhoods thrive on community support that's innovative or smart, with transportation options and housing options. Over the next 2 years, we're leading an assessment and a strategic planning process to ensure we're ready for our boomer opportunity. An opportunity to keep our residents of all ages and tap into the economic force that is the 50-plus crowd. We will ensure that Central Ohio continues to be an economic engine. And all of this is done through our 115 dedicated committee members, advisory council members, and most importantly, our 50-plus residents. We know the realities of affordable housing and potential caregiving shortages, and we're committed to listening to the concerns of our residents. Our long-term goal is to take the voice of our older adults and ensure it informs the future development, transportation options, social services, and much more. Age-Friendly Columbus is planning with older adults, not for. They are involved in every step along the way, providing invaluable information. For who better to help us plan the future than those who have lived the past? So when we talk about listening to our residents, we cannot help but think of our moderator. Councilmember Stinziano is the chair of Age-Friendly Columbus Advisory Council. He's been our champion since day one, and we truly enjoy his leadership. So, council member, besides the fact that we know you poll very high with older adult voters, why else are you so engaged in Age-Friendly Columbus?
Well, thank you, Katie, and thank you all for the opportunity to be here. My history with Age-Friendly and learning about challenges for populations not only in the city of Columbus but across the state of Ohio actually started when I served in the legislature. Like a lot of people, my grandmother had a fall. That fall led to my grandparents having to leave their home and look for other housing options. To do that to a couple that had been in this residence for over 45 years was gut-wrenching for a grandchild to watch, but also tough for my parents and their family. So I was fortunate when in the Ohio legislature to work with Representative Cheryl Grossman on legislation for livable homes. And that journey on livable homes and making homes accessible for all really led to a passion and awareness of how important age-friendly is and how important the work that we have ahead of us. So when Katie called on behalf of MORPC and sitting down with MORPC and aligning with some of their visions, the opportunity to serve as one of the co-chairs was something I jumped at. I have to mention my other amazing co-chair, and Fran Ryan. Any opportunity to work with her as well was one that I couldn't pass up. But I've been very fortunate, been at the city about 192 days as a council member. We have a wonderful new mayor and Mayor Ginther who understands the value of not only the work that this initiative is going to produce, but that commitment that while we are very excited to be a smart city, we recognize being a smart city includes all our residents. For a kid just from Columbus, knowing the generations that want to stay here, that are passionate about being here, the work of this committee is going to be one that really sets that foundation. So very fortunate of the work with the administration, Mayor Ginther, and my colleagues on council, their support as well. So that's kind of how I got here, Katie. And as you heard, we've got a wonderful, wonderful panel, and looking forward to having them kind of provide their expertise, their experience, and look forward to your questions when that time arrives. I'm actually going to start with Mr. Sinclair. Mr. Sinclair, what motivates you to become involved with Age-Friendly Columbus?
Katie White. She has that very nice, persuasive way that makes it very difficult to say no. But actually, we met at I think she was dealing with Village Connections at one time, and that's how we met. And I think it's very important that senior citizens are part of whatever plans may be involved as far as Columbus is concerned. I like, there's an advertisement with Farmers Insurance that I really like. The spokesman says, we've seen a thing or two, so we know a thing or two. And so not to make plans without dealing with our senior citizens would be a big mistake.
Well, in regards to seeing a thing or two and knowing a thing or two, the Osteopathic Foundation has really been a leader regarding their healthy aging initiative and continuing to use that initiative. And I was hoping Susan can talk a little bit more about how that aligns not only the work you're doing, but with the Age-Friendly Columbus initiative.
Thank you all very much for being here today. It's my pleasure to represent the Osteopathic Heritage Foundation. I think early on, we began to understand through some collaboration actually with our colleagues at the Columbus Foundation about some of the demographic changes taking place in Franklin County. Together we sponsored some research that was led by the Kirwan Institute. And through that research, we really wanted to have an understanding of what does it look like for an aging population in this city at this particular moment in time. And I think one of the things that was really kind of startling for all of us in review of the report, and there was actually a CMC panel dedicated to looking at those findings, was just as we have health inequities related to infant mortality in our city, there's a pretty extreme health inequity in terms of older adults. And depending on your zip code, you may have a life expectancy of might be your peer otherwise, but because of zip code, there's a 20-year discrepancy in how long you may live. And so clearly the people in the community who are the most disadvantaged have less access to resources are those individuals who are living 20 years less than their peers, just even a short distance away in the county. That, in addition to the foundation's kind of long interest in working with vulnerable populations in our community, really kind of challenged us to look at how could we engage in a process that was really transformative, knowing that this will affect all of our lives. If you personally aren't experiencing it, maybe your parents are going through some very difficult struggles. So this is not kind of a isolated experience. And through some research that I did, I began to learn about age-friendly communities. And then I met Katie White, who was also thinking about age-friendly, and it had been a topic taking place in a number of discussions for several years in Columbus, but there was some synchronicity between where we were headed as a foundation and knowing that the model of age-friendly communities really creates a brain trust of extremely committed, wise people, and also make sure that the people who are most could stand to benefit the most or are affected the most by public policy are engaged. And I really kudos to MORPC for kind of taking on this initiative and bringing such great people together to really look at some of these issues.
And I'm always excited to share the stage with Chuck Gehring and Lifecare Alliance. One story that always stood out, again, happened a few years ago when we lost a lot of power across the city. We had that horrible storm, and Chuck and I don't know if you called me or I called you, but we were discussing how to help residents that look forward to those hot meals, and when they don't have power, how they get those hot meals. And Chuck makes amazing things happen and got the governor on the phone, ended up having the National Guard go door to door to check on those residents. And that was something that when we talked about who do we need on an age-friendly panel and part of this collaboration, I said, you got to have Chuck. Chuck and what Lifecare Alliance does every day engages, keeps these older adults living in their homes. And so I was hoping, Chuck, you could share some of your experiences, not only in that story, but what you see day to day where we have gaps, where we can continue to improve to make sure Columbus continues to be or moves forward to be age-friendly.
Well, thanks, Mike. after doing that, and we never got to the governor, Mike, if you remember. We were a few steps lower than that. But after doing that and getting the National Guard engaged, Mike and I are still on the terrorist watch list here in Central Ohio. But Lifecare Alliance, in cooperation with a lot of folks around here, the Central Ohio Area Agency on Aging is a funder to us, the Franklin County Office on Aging is a funder to us, et cetera, and we fund a lot of our own stuff through fundraising. But we currently have 15,000 active clients in our database and that are active. That means they got at least one thing from us last month. We also have 50,000 total in our database because many people come in and out and they don't just come and stay forever with our programming. Many are hospital patients coming out of the hospitals, and we partner with all the hospitals here in town. I know Kent Hess is sitting out there from OSU. I saw him earlier. There he is. And they know that they can send us people, and we will help them. And this is vastly different than what goes on in many other cities around the country right now. Services can be scattered. We are often poorly funded. And things are difficult for folks. I don't know how many of you know this, but ARP calculates every year, and the State Department of Aging calculates every year how much it costs to go into assisted living or nursing home care if you're private paying it. Now, National Church Residents, our sponsor for today, does a super job of building housing for people here in Central Ohio. We are in doing dining centers in some of their buildings and things like that, and they have independent living and a little bit of everything. But if you have to go to that assisted living or nursing home situation, right now the average cost is $6,200 a month, okay? And nobody's really ever checked the box on our surveys that said I'd rather be in a nursing home than in my own home. So we try very hard to allow people to stay in their own home. And again, we're very blessed here because services tend to be more consolidated here in Columbus, Ohio. In Cincinnati, in Cleveland, to give you an idea, the great Cleveland, with LeBron and everything else, is very scattered doing our kind of services. And there's a lot of other services that we provide that are not even offered there. So it's a difficult situation. And you start looking at it, and the fact of the matter is that most of the people in this room today, including me, will someday be existing off a Social Security check, right? And that's not going to be enough to pay to get us to those lovely living arrangements sometimes that we might want to go to. So it's important that we try to make a city that is very friendly to people, that people can stay in their own home and thrive as seniors as they grow older until they can get into housing that makes sense for them. And I would tell you, to compliment NCR again, since they're here and they're a sponsor today, they do a lot of housing that services low cost, low income folks, and people can get into their housing at a lower rate, but there isn't enough housing to take care of all these people. There just isn't, and they can't build it fast enough to get to everybody. So it's one of those things. I would end with this. We had 10,000 active clients here at the end of 2010. We had 15,000 active clients at the end of 2015. You know how many we're going to have at the end of 2020? Want to guess? Well, it's about 20. Thank you, whoever said that. 20,000. Somebody did math over here quickly on a calculator. So, and the numbers are going to keep going up, and the funding, there's no more money. So we've got to figure out innovative ways to take care of people and make sure that they're happy, healthy, and can access everything they need in Central Ohio.
So, Mr. Sinclair, when you hear happy, healthy, and access, what do you think some of the challenges older adults currently face? You live downtown. You have that experience. And just curious, your thoughts as we begin the age-friendly initiative, and particularly that older council, which is going to put us all through our paces. What challenges do you think we can be improving on, or do you think should be a real goal for the initiative?
Well, let me paint a picture for you. The building that I'm living in, J.C. Arms, is located at 266 East Main Street, which is between 5th Street and Grant Street. Grant Street, I guess it is street. And the building houses over 200 residents. across the street, Main Street, by the way, is a one-way street until it gets to Grant Street. So therefore, you have 4 lanes of traffic. And whenever you have 4 lanes of traffic, the traffic moves very quickly. On the other side of the street is a COTA bus stop. And many of our residents utilize that COTA bus for transportation. Watching them go across that street is like watching a horror story. You know, are they going to make it? And getting across that street is an adventure. Katie invited me to a transportation seminar that they had not too long ago, and I brought that situation up. And at that particular time, when the residents did make their way across the street, there wasn't even a bench or anything they could sit on, and COTA bus kind of stepped up, put a shelter and a nice bench there. Now, down the block, further down the block is Franklin University. Franklin University, for its young, able-bodied intellects, they have a building on the north side of the street and the south side of the street. They have a big, pretty crosswalk for these young folks to make sure that they can get across the street without any danger. I have my brother lives on Mark Road, and we were just talking about crosswalks and so forth. And he was telling me about a crosswalk they have on Sunbury Road for bikers, because the bike trails go across there. And he says they have a stop sign, both sides of the street. You hit a button and big yellow lights go off. Make sure the bikers get across the street safely. Meantime, okay, my neighbors are dodging the traffic, trying to get across that street. It's kind of hard to convince us that Columbus is age-friendly. It's a starting point. I'll stop there for a minute.
Sure.
So as council member mentioned in our Older Adult Advisory Council, we don't hold anything back, right? So this, to us, these kinds of examples are so important so that we know if there's an area of the city that's densely populated with older adults and there's a specific need they have so that we can encourage them to use current transportation options, then by all means, we need to hear it, we need to know it, and we need to figure out how to fix it.
So in a few minutes, we will be moving to audience questions, and there will be a microphone there. So for those that are looking for it, and we really encourage some Q&A, please get ready. But we'll go with one more question to Susan. Given your experience in the foundation's work, where have you seen innovative programs, or what innovative programs do you think this initiative should be looking to implement or model after?
Well, I think one of the things that is really impressive about the framework from how the age-friendly model was considered, it's a World Health Organization. Initially, they looked at a number of different domains that impact the lives of older adults, and those domains are very comprehensive. I think the model in and of itself is really innovative because of how older adults are engaged in the process, and also committees are formed that represent leaders in communities who have really been working on these issues. Kind of two things that I think we are hopeful at the foundation that may come out of just the action plan that will be created is really trying to address the transportation issues that older adults in this community face. We just recently had, about a year ago, we did a request for proposals looking for provider organizations in the Columbus area to really kind of give us a sense of where did they feel like there needed to be change, where there were gaps in services. Many of those proposals requested funds for transportation. It's just an issue that doesn't go away, and it's essential to, as Chuck explained, for people to have safe transportation that they can access, but also it's essential to people being able to stay in their homes, which will be a growing need, and it's, I think, something like 95% of people, when surveyed, say if they had their choice, they want to stay at home. So we're kind of hopeful that all the great people that are involved in Age-Friendly Columbus can kind of come up with a comprehensive plan and strategy around that. We also know that there's great services in the community, making sure that people have access to food, but Ohio is #1 in the Midwest of older adults being food insecure. So that means not knowing where their next meal is coming from. We can and should do better. That feels unacceptable to me, and I'm sure many people in this room. There's a great networks in this city who are trying to make sure that that basic need is provided to older adults, and so that's something we're kind of keeping our eye on too, in hopes that there can be a coordinated effort to really address that issue and make that number go down.
I think Katie wanted to.
I do. I just want to add one more thing. So to give you a framework of how this all is working, the World Health Organization is working with AARP as the U.S. affiliate. So they give us these guidelines, which many cities, I think they're up to 84 across the U.S., follow the same sort of guidelines. Now, you can personalize it to your own city to make sure it works. And for us, that means working with all of our key organizations around town: Central Ohio Area Agency on Aging, Franklin County Office on Aging, Lifecare Alliance. So bringing together the big groups to make sure that this mold set forth works for us.
Wonderful. So we have reached that wonderful point in the lunch, and Andy told me I have to say this word for word. It is CMC's tradition to take audience questions. Please state your name, ask your question, and we thank you in advance for not making long editorial comments. Let's proceed to our first question.
Thank you very much for a very informative conversation. I'm Amy Claben. So my question is, a number of panelists commented about the need for affordable housing. I think that encompasses both the cost of housing and the quality of housing. So could you address what kind of policy changes should the city and the state be looking at so that our seniors could age with dignity? And in addition, address whether a rental subsidy program would be helpful to seniors and what we could do to bring that here in Columbus. Thank you.
Who's the lucky panelist? You going to take it, Chuck?
I don't care. Well, Amy, as you know, coming from Homeport, any kind of subsidies for any kind of seniors are important because none of them can afford what they do. 70% of our clients live on under $1,000 a month income, which is a Social Security check. And my mom was one of those in her later years and things like that. And you figure that out at $12,000 a year. How do you pay if you're in your own home, which they want to be? As Susan said, it's everybody wants to stay in their own home if they can. For the most part, you can't pay your property taxes hardly to get through things. And then you're deciding between, am I going to get health care this month? Am I going to get food this month? What other things can I take care of myself with? Can I keep my car going? You know, people give up pets because they can't maintain the cost of their pets. So there's all kinds of things that would be wonderful. The question is always money, right? And, you know, we've seen our money go down. Since the recession, our agency alone has lost $5 million annually in traditional funding from the government in United Way. Now, we've made all that up, but we run we do crazy stuff to raise the money, okay? So if you get my holiday appeal card, do not throw it away. But anyway, the point, and we have a catering company and do all this other crazy stuff, is what other people are doing too. And, it gets tougher and tougher for these folks. But we're very fortunate here in Central Ohio. I want to make this point again. I sort of said it, but I want to make this point very clear. Our services here in Columbus, Ohio, and Central Ohio are far advanced from other cities in the country, our size, larger, and around the Midwest. I got to go to Chicago a couple weeks ago, and I was talking to people from all over the country about different things. We tend to, and I'm not saying this to pat ourselves on the back, but our program gets held out nationally by the Federal Department of Family Living as being the program to emulate, and that's because we take everybody. It's not rocket science. We just take everybody. Well, there's really no other major cities in the top 50 in the country, taking everybody. They got waiting lists. So all those things need to happen there's a combination of things is the bottom line to help out. And then, fortunately, there are some things. Again, the NCR folks build beautiful buildings that you can get in as a lower-income senior if you need to, and things like that, if you want to live in a place that's gorgeous like that and get out of maybe a tougher neighborhood where you can't access services. Right, Mr. David? Daniel. Right, Daniel? I thought I had that right. Okay, I'm an idiot, but anyway. But that's kind of the story with that. So yes, anything like that would help, but I don't see it coming.
Hi, I'm Meg Tieford. I'm the president of the board of Village Connections, which got mentioned earlier. I wanted to actually ask you, if I were a younger adult, why would I be interested in age-friendly Columbus? And maybe you could say a little bit about the impact on the whole age groups.
I mean, I get looks every time I tell people I'm co-chairing this because I tend to look a little younger, although on council I'm a little older. I think we recognize the value that we will be part of that older population sooner rather than later. When you look at the MORPC projections and for our growth, where the curve is, we fall right into that category. And so while this isn't self-interest, there's obviously an immediate need that needs to be addressed. We have a growing population within the city of Columbus that's going to be taking advantage of what this initiative is able to put forward and what the city and the administration are going to be able to accomplish.
And I'll just add, in having the project at MORPC, we've got access to these amazing and brilliant city planners and engineers and people that are thinking about planning the environment for people of all ages. So if we're planning it to the level of making sure older adults are inclusive, then we've included everybody. And we can push our strollers down the street and people can ride their scooter or, whatever it might be. So planning for age-friendly Columbus is actually planning for people of all ages.
I think I know a couple of these people. I'm Adrienne Corbett. I'm currently Executive Director of Homeless Families Foundation, but in my past life, spent 35 years working with older adults. And one of the questions that comes to mind, and not being familiar as I should be with the age-friendly program, is, are we talking at all about caregivers and the role that caregivers play in working with older adults? I am quickly approaching that 1 in 4 that will be 65, which is really pretty scary from a certain perspective. But knowing even 20 years ago what the impact of caregiving had on the workforce and how it affects the health of our community, not to mention the health of the older adults themselves. There's lots and lots of I'm talking to the choir, I know, in terms of being that adult caregiver and all of the many decisions that have to be made. Is that part of the planning process?
Yes, Susan, I don't know if you want to touch more on that, but we are certainly in tune with the caregiving needs, and because we've only been up and running for 5 months, we haven't gotten to that point yet, but we will be having caregiver-specific groups that meet because you're exactly right. There are impacts in the workforce and just even having enough caregivers to take care of all the people that want to stay in their home. So absolutely. Oh, I lost you. Oh, there you are. Absolutely. And also on our housing subcommittee, I'd love for you to join us. So thank you. Gotcha.
I would also just add that there's some interesting national legislation afoot. There's a woman named Ai-jen Poo she's written a book about kind of the role of caregivers, and part of what she and a coalition of organizations are looking at is how to ensure a living wage for those workers that we are entrusting so much to and rely on so much. Making sure that they have health care benefits that aren't pretty much taking most of their salary. So there is some work to really try to understand both kind of the workforce development issues, but also once people enter that field, making sure that they're cared for equally well.
Hi, good afternoon. William Tarter from the Center for Community Solutions. Drove down from Cleveland for this, and so thank you very much for hosting this event. I'm excited to be here and to learn so much about what's going on in Columbus.
Get out of town before the convention.
Amen to that. So again, thanks very much for a fantastic panel. My question centers on when we look at the state, we see that a lot of communities across the state are going to be dealing with aging issues. I think half the state will be experiencing individuals of 60 or over who will be at least 30% of the population. So my question centers on the relationship between local communities and the state as we head into these aging issues. Is there a role for the state to play, and how can we work better together to address these types of issues?
So I'll start, and then you make sure I'm saying the right thing.
He lobbies the state much better than I do.
I guess just the point that I would like to make is that in our assessment phase, we'll be really pulling in the numbers to back up what we all think is the right answer, to say, we've asked the right people, this really is what they want, these are the priorities, to give, to have that data backup to fall onto.
Okay. I think there's a role for everybody. So there is a role for the State Department of Aging, and Bonnie Cantor-Berman's very much into this. And, this current administration, Governor Kasich, and it doesn't matter who's in the State House, whether it's a D or an R, but Kasich's group has taken 6,000 people to date out of nursing homes and gotten them home. And that's very critical, not only for their own well-being and their mindset, but to the question earlier about what happens, why are young people interested in this? When older people go into assisted living or nursing home care and Medicaid kicks in, they're paying for it. It's tax dollars, and it costs over $70,000 a year to put somebody in a home that they don't want to be in, and it's horrible. So there's a role for everybody. Now, how can we get together? That's a good question. I think we've all lived in our little kingdoms for a long time, and it's important that we meet with others from around the state. Cleveland, Columbus, Cincinnati, Toledo, et cetera, should be getting together on these things. And I'm a big advocate for that, so give me your card. And we'll get together. But I think if we'd all work on it together, we could really, there's savings there involved, there's things to do, instead of trying to, everybody wants to be involved now with seniors because it's the hot ticket, so to speak, or it's not the hot ticket, there's no money. So we need to get together. We need to get together and work on these solutions together, and that's a critical piece to make this successful. So good question.
Michelle Norris with National Church Residences. So thank you all for the panel. I completely agree with your conversation that we need to be working collaboratively. I will say, as a native of Columbus, that I spend a lot of time in other cities. We really are one of the most collaborative cities that I know. And so I have great hope for what we can bring and we can lead as the others as they're facing the same issue that we're going to be facing. That being said, convenings like this are great. We're going to be hosting another convening in late August to also have similar conversations. Kate, I guess I'd ask you or Mike, if this is, how do we stay in touch? What's the best way for this group to know what's going on? It's pretty much a 2-year look. Can you tell us more about how we stay up on what cool things you guys are working on?
What a wonderful question. Timing. We just started our Facebook page today, but also in our Our name is on the back, and there's a sheet in the back. We've got a website, and we'll also be doing quarterly newsletters. If you want to sign up for the newsletter, my name's on the sheet, and you can email me. Am I missing anything? I'm looking at my MORPC colleagues. Yeah.
I think finding Katie's contact information and contacting Katie or my office, we're happy to help, but it all ends up going through Katie. MORPC found a rock star in her work with Village Connections, the story they tell, the people Katie's been able to bring together, our colleagues with the Beachwald Community Center, for example. It really has been a great collaboration. But we have that challenge of getting the word out. We're working hard, always trying to find those ideas. There's only one Fran Ryan, and she can only meet with every senior once, maybe an entire year. And so she can only tell that story once. And so we're working hard. And so any ideas, any engagement, not only of what we're up to, but other ideas. We are very open in that while we have this 2-year process, that we're looking for other areas that maybe we didn't think of, and we've seen a lot of that in our first 5 months.
Hi, good afternoon. Thanks for being here. My name is Cynthia Doherty, and I'm the Director of the Office of Geriatrics and Gerontology at the OSU Medical Center. I'm curious if there's been any conversation about education and training. You've mentioned that there's a role for everyone, and there's a reason for young professionals, young adults to be interested. I talk to students all the time who maybe don't quite get it. Or who say, I'm into children, or I want to be a preschool teacher, and I say things like, do you know how many grandparents are raising grandchildren? And you need to know something about the population that's aging. Has there been conversation about education and training, and even maybe before workforce development kinds of things?
Yes.
Sinclair?
Yes.
So a couple of conversations within that conversation, right? So there's the employment piece, which absolutely training employers on how to best support older workers, training employees, and we've got Carol Ventresca, thankfully, helping lead that charge, but also the socialization piece, the intergenerational piece, and really, again, just kind of re-engaging that neighbors helping neighbors and trying to get kids exposed. So as someone that's gone through the Office of Geriatrics and Gerontology specialization in aging, absolutely there's a role for that, particularly with so many students in town.
And I would tell you, if I can chime in on that for just a second, at Ohio State, if you could, we live off volunteers at our place. And there's a great need always, and you have 50,000 of them sitting up on North High Street who are young and have cars, which I never had in college. So if you can, I think a great thing for your office to do through Ohio State, and you're probably already working on this, is engaging those students into volunteer activities. I know we get a boatload of students from Ohio State to help us out all the time. And we couldn't live without them. So the more and more, I think if they get engaged in that and they deliver a meal or they go out and sit with somebody or they talk to the seniors, they're just it's gonna light up their life. I talk to different groups all the time, and I'm on campus every now and then. I'm a Buckeye, and I'll come anytime and talk to anybody as long as you feed me. And that's a joke. But anyway, the students I find are really engaged. They want to be engaged. The Fisher surveys the students coming out of Fisher every year. And one of the questions is they ask the people that have jobs coming out of Fisher, what are the characteristics of the company you're going to go work for that are most important to you? And the number one answer for, I'm going to misquote this, so just bear with me, but for the last 5 years or 7 years has been, I want to impact the community while on company time. So get them out and deliver a meal on wheel at lunchtime, and they're happy campers. And OSU, Marion has a route, just so you know.
Mr. Sinclair? Was there anything you wanted to add?
I do. I just want to say one thing. There's a saying that I've I love to say and I love to hear, and it was from a great philosopher who really was called the hardest working man in show business, and I'm talking about the great James Brown. And James Brown said, saying it and doing it's two different things. In fact, it's just as different as night and day. So indeed, it's always pleasant to hear folks talk about making the city age-friendly. But the important thing is that we do something about it, all right? And I believe every time we do something, it makes an impact. Of course, when the city takes care of that crosswalk that I'm talking about.
Name it after you.
Which I'm sure will come about. But there's more than the 200 people in the building. Of course, it affects them, but it also lets their friends and their neighbors know that Columbus is sincere about being an age-friendly city. Also, the folks that are driving down the street, and when they have to stop at this crosswalk, where they're going to put a pretty light or something for our citizens across the street, all right? Then they indeed also will understand that Columbus is truly going to be an age-friendly city. And I was talking to Katie about about those signs that they have in the works.
The age-friendly logo?
Age-friendly logo. And I think everyone in this room can start participating in the age-friendly movement with the restaurant that you go to. Are the bathrooms, I know a couple of restaurants, I like the food and everything, but boy, getting in the bathroom is a trip, okay? Because I never could understand why you have a steel door to get in a bathroom. But if those restaurants will make those changes so that indeed they're accessible to you and your neighbors, your relatives, then the movement is on its way, if you understand what I'm saying. So.
And we have time for one more question.
I'll make it quick. My name's Jane Scott with the Metropolitan Club. This is not a local question, and I know that the task force is part of a bigger initiative. You talked about the World Health Organization, AARP. So my question is there going to be like a Seniors 101? I mean, we are amassing the information so that other communities can share it. Is there a group of Katie Whites that are meeting across the United States so that every community doesn't have to invent the best practices, and how is that happening across the nation and maybe even across the world? Every community in the world is facing these same things.
Yes, most certainly. There is a network of AARP livable communities. So I think 84, I'm going to look at Doug, 84-ish, 95 communities in the network. And we all have access to information sharing and best practices. We have an annual conference. I speak to the Age Friendly Cleveland and Age Friendly DC coordinators quite often. So definitely a lot of best practices and information sharing.
So thank you to our wonderful panelists. Thank you all for your great questions. I'll return it back to Ms. Moore.
Thank you, everyone, for attending today. I hope you enjoyed today's forum. We encourage you to continue the conversation with coffees and cookies. You can view and share today's forum and all of our forums on CTV, Columbus Television, on WOSU, and PBS affiliates statewide through the Ohio channel, and anytime on CMC's website via YouTube. Please thank our sponsors today, Regionomics and National Church Residences. And our speakers, Chuck Gehring, Susan Beaudry, Daniel Sinclair, Katie White, and Michael Stinziano. We hope you can join us next week. You might want to check out the flyer today, The Bellwether, Why Ohio Picks the President. That is next week's forum. Okay. Thank you very much for attending. Have a wonderful afternoon.